Hey, hello, and welcome to the Feel Strong Fitness Podcast. My name is Justin McClintock, and this week we have Dr. Jessica London on the podcast. Dr. London is a doctor of physical therapy, pelvic floor therapist, pre and postnatal coach, and now podcast host. She's also a mom with two kids under 5 and the founder and owner of Your Postpartum PT and Wellness. Dr. London, welcome to the show.
Yes, Justin, thanks so much for having me. This is such an honor.
I'm very excited to have you. I was in your talk at the Real Coaches Summit. It would have been, as of time of recording, about a month ago, I think. And I've told anyone who would listen that you were the highlight of that summit for me. It was such an unexpected joy, such a cool perspective, and so important. I was jumping up and down, just recording Instagram stories in my hotel room about how trainers needed to hear more of this stuff, and lay people, citizens, pregnant people, moms needed to hear this stuff because there's more ways forward and more ways in than even I had as a relatively educated person on this kind of stuff knew before.
Thank you so much. That means so much to me too. And I always like to try to break down super complex topics in a really simple, tangible, practical way. So I'm glad that that resonated for you as well and all the other coaches there too.
100%. I Before I got home, I had the pelvic floor questionnaire in my True Coach and feeding documents to my clients. Like, it was the first thing I did.
Yes, that's the best part to start, right? Like if you are working with people, women specifically, especially, men can have pelvic floor issues too, but women specifically, having them on your roster, they likely are dealing with pelvic floor dysfunction and we don't know unless we screen for it. So that's step 1. So kudos to you for already implementing that. That's amazing.
Well, it was entirely inspired by yourself. There's lots of places I think we could go with this, but before we jump too deep, I always want to make sure we set a foundation for people who may not know or might think they know but aren't quite sure. Could you kind of give us a simple-ish explanation of the function and importance of pelvic floor, maybe especially around birth and being a mom?
Yeah, absolutely. So I guess I love to just get this started with everybody has a pelvic floor. I think oftentimes, men think, oh, that's just a women problem. And you have a pelvic floor too. So men, children, women, we all have pelvic floors and they all serve as basic functions of our daily activities of, living, right? So they help us with our bladder and bowel habits. They help us conceive babies and deliver babies. They help us just support the bottom of the pelvis so that our upper and our lower extremities can do its thing on a stable foundation. There's so many different functions. There's 5 major functions of the pelvic floor. And when we start to know those, we can start to spot dysfunction. So what's really important for people to know is that if you are experiencing any signs and symptoms or issues with leaking or issues with pelvic heaviness or pain, that this is likely a pelvic floor related issue and should not be dismissed.
Well, that might be the most logical place to go because fortunately, I think fortunately, at least for in my world, the past sort of 5 years, I feel like pelvic floor health has been talked about a lot more, where 10 years ago, I never heard about it. So,
Mhm.
really great that it's being bumped to the top, but I think people aren't really sure what it encompasses. So, if we're talking signs and symptoms to look out for, if these things are happening, it may indicate some kind of pelvic floor issue. Maybe they need help. Maybe they need to do a personal screening, etc. What kind of signs and symptoms are we talking about?
Yeah, absolutely. So, signs and symptoms would be if there's any lack of support in the pelvic floor. We tend to notice this with some pelvic organ prolapse symptoms. This could be known as like pelvic heaviness or pelvic dragging. And our 3 internal pelvic organs are our bladder, our uterus, and our rectum for women specifically that sit just on top of the pelvic floor. And the pelvic floor is a group of muscles, connective tissue, nerves, blood flow, all of those things, right? So, those pelvic organs that sit on top of the pelvic floor, one of the functions of the pelvic floor is support, right? So, when we are seeing a dysfunction in the support feature, then this can feel like pelvic heaviness, right? And otherwise known as prolapse symptoms. Other areas are sphincteric, right? Sphincteric is another main function of the pelvic floor. And we have these small little circular muscles around our urethra where pee comes out and where our bladder allows urine to flow. And then we also have a sphincter around the vaginal canal as well. It's a more of a muscular tube in that vaginal canal. And then again around the anus, right? So there's the anal canal and there's an anal sphincter. These sphincter muscles are always on a low grade constriction, right? So this allows for us not to be walking around, peeing our pants, or having, accidents. So, a dysfunction of the pelvic floor for this sphincteric function is where we're actually seeing leakage, whether it can be bladder or bowel, right? This can happen for either or. It could also be urgency, where you feel like you have the urge to go to the bathroom and you have to rush to get there because you don't have good control over it and you have to like go there quickly. But it could also be any leakage with just everyday movements, picking up your kids, walking, carrying, but also with more higher impact activities, which we see very commonly postpartum with like jumping jacks or jumping rope or going for a run. Any signs of leakage would also be a sign of pelvic floor dysfunction. And one more big one that I want to kind of encompass the other parts is, the neighbors of the pelvic floor. Oftentimes we think of hip pain as hip pain or tailbone pain as tailbone pain and back pain as back pain. But more often, what we're finding is that is actually related to the pelvic floor. And when the pelvic floor is in a state of chronic tension or hypertonicity, as we call it, where there's a lot of constriction, a lot of tightening going on at the pelvic floor, this can cause issues to the neighbors of the pelvic floor. And the neighbors of the pelvic floor are the hips, the tailbone, the pubic bone, the back. So, oftentimes, what we're looking at with women, specifically pregnant and postpartum, is the neighbors that are surrounding the pelvic floor, too. So, chronic hip pain, chronic tailbone pain, chronic back pain, that's not typically resolved with your normal hip or back type modalities or strength training or whatever it might be. This could be an indication or sign that it's actually more related to the pelvic floor and the pelvic floor is driving it versus it truly being a hip issue or a back issue, etc.
Now, as someone who does a lot of work with people in hip pain, back pain, a significant number of my clients are kind of post injury, post physical therapy, return to activity, return to fitness folks. Are there things they can do, or maybe I can do with them to shorten that process? Because correct me where I'm wrong, what I just heard you describe is you come to me with hip pain and back pain. I'm going to do all my assessments. I'm going to do some stuff. Okay, we see some imbalances. We're going to go after this. We're going to test. Oh, we're not there yet. Okay, we're going to try some other things and improve range of motion. We're not there yet. Okay, we're going to strengthen some stuff. We're not there yet. Oh, it turns out there's some pelvic floor issues that we have yet to address. I don't want to spend 4 months if there's a way
Mhm.
for me to cut that corner or a way for them to do it themselves if they're not working with one of us. Are there things people can do, can self screen to kind of get this information faster?
Absolutely. Absolutely. This is such a great question. So, first and foremost, your screening tool that you've already implemented, this right off the bat will tell you if the pelvic floor is involved or not involved, right? So, if someone has hip pain, but then they check no on all of the pelvic floor screening stuff, hey, might just be a hip, might just be a back, it might just be, muscle imbalances, it might just be structural imbalances. It might just be as simple as that. But if we do that if that we do that pelvic floor screening at the very beginning, we know right off the bat, is the pelvic floor involved or is it not? Because typically the pelvic floor will manifest into other symptoms like we talked about with the leakage, with the urgency. This can also be signs and symptoms of like pain with intimacy or in the intimacy department in general, depending on how deep we want to get into that part.
As
It,
deep as
it
you like.
right. So like yeah, other intimacy topics are like, inability to achieve an orgasm or painful with orgasm. Like these are also signs and symptoms of pelvic floor dysfunction that also very commonly correlate to hip pain or tailbone pain or low back pain. So, really, it's how deep do we want to go on asking those questions? How confident do we feel? How quickly can we give someone a pelvic floor screening? And if there is just pelvic floor dysfunction present on that pelvic floor screening tool, then we know that we probably should be looping somebody in that is an expert in that category so that you can co treat or co work together to make sure that this client gets the best, foot forward. But other ways is kind of like you talked about, as you're testing, you're retesting, you're assessing, you're reassessing. Sometimes we do the mobility at the hips or the mobility at the back or the lower extremities, the upper extremities, the rib cage, right? Oftentimes we're not teaching people, or the coaches or trainers might not have the skill set or knowledge bank at the time to also treat or instruct how to release and lengthen the pelvic floor. So, with hypertonicity and chronic tension being very common for a pelvic floor dysfunction driver that's causing hip or back or tailbone issues, we also need to create mobility at the pelvic floor, just like you would create mobility at the hip joint, right? So, we want to create mobility and full range of motion of the pelvic floor too.
Completely. That makes total sense. And there's an important point here that I remember from your talk actually and got me really excited. And it's drilling down on the difference between hypertonic and hypotonic because so many people are doing, doing their Kegels and crushing it and working and working and working when in fact we need to be working on mobility. That was a terrible explanation, but you're about to make me sound smart.
Absolutely. Yeah, absolutely. So we tend to categorize, for simplicity purposes, right? We tend to categorize the pelvic floor being hypotonic or hypertonic. And what that means is hypomobility is where, like, if I kind of gave you guys the example of the slinky, and I think it's a really great visual or example too. If you think about if you pull a slinky all the way open, those rings of the slinky are really elongated, they're really open and there's a lot of buoyancy in that slinky, right? And so when somebody is more hypotonic, they might have too much range of motion. They might be too loose, if you will, or not, not metaphorically speaking, but like the tissues might be a little bit too elongated. And we really need to focus on contraction and shortening and strengthening and endurance holds and, higher reps and more strength and all of those things with hypotonicity. But with hypertonicity, it's that slinky that comes in the package all coiled up, super short and tight, where there's no space between those metal bars. And so when we think about the muscle fibers in that way and in that space, hypertonicity doesn't need more Kegels. It doesn't need more endurance hold or more strengthening or more contraction, which often kind of drives further symptoms to the person. They end up doing Kegels and all these bridges and exercises to make the pelvic floor quote unquote strong. And it actually makes their pain with intimacy worse, or their hip pain worse, or their pelvic pain worse. And they don't understand because they're just trying to follow the standard advice. So it's really important to understand the state of the pelvic floor. And even some of the symptoms can cross over, right? Like just because you have leakage doesn't mean it's because you're hypotonic or hyper. Like leakage could happen with both. So that's why it really is like, okay, let's ask more questions. Let's dive a little bit deeper to really understand like what state is the pelvic floor currently living in? And how do we regain like homeostasis and full range of motion in both directions? And then from there, we'll work on strengthening on the surrounding structures as well.
Yeah, I think it's a really important point because people, I mean, like so many things, so many people have back pain, they do a ton of ab work. Like, well,
Mhm.
maybe, but this might be a waste of your time or actually making things worse because you're exacerbating these other conditions because we haven't looked at, frankly, the entire picture. And my understanding is you guys do this too. We always look at the entire human being at Feel Strong. Like, yes, I care about your weight and your reps and your assessment, your mobility, but I want to know how you sleep and how your relationships are. And if your husband was a jerk to you and your kids are driving you crazy and work is insane, because all of that is going to affect how you respond to these things and is a part of the program that we create. I've worked with lots of pregnant people at this point and been fortunate enough to take several moms through multiple pregnancies. I frequently run into this idea, and I've heard you speak about this, that pregnant people often feel extremely selfish, kind of putting themselves first, especially if they already have kids or other things going on in family. They put themselves kind of third, fourth, fifth in line. And I feel like they don't recognize that being really selfish is going to let them show up in the ways they need to show up in all of those other places. Like
Mhm.
being selfish and addressing your pelvic floor issues and addressing your strength issues and addressing your stress issues will make you a better mom, spouse, community member, et cetera, et cetera. How do you feel about this? Does this ring
Thank
a
you so
bell?
much for saying that. I concur. It's so true. I mean, it's so true. I think this happens more commonly with women and specifically mothers, right? We just end up giving and giving and giving. And then, you have to ask the question of like, when does self sacrifice become self abandonment? Right? And like, when are we sacrificing ourselves constantly for others, but we're actually really abandoning ourselves as women and as mothers? And when mothers go abandoned, it really doesn't actually serve the family very well at all. So I love that you bring this topic up. It's something that we often find challenging for our mamas too. But really, when we can speak life into them and when they know that they're worthy of the change and when they recognize themselves, like, you know what, I'm literally living for years with a condition that is solvable in 3 to 6 months. I can't say speak for everyone, but that's us. we can solve issues in 3 to 6 months when clients have been dealing with them for years. And so for me, it's like when I can, talk to a mom and really hear her journey and hear her story, I can validate, yeah, it is really hard to invest in yourself, to take that time, but also recognizing like the timing is never going to be good. That's why you've been still struggling with this for 4, 5, 6 years. Like it's never going to be good timing. We have to create the timing. And so we also have to believe that we're worthy of seeing those changes as well and stop putting ourselves on the back burner and totally abandoning our bodies.
100%. And I feel like some of that is the idea that this sort of like general loss of control, like, oh, it's not my life anymore, my identity is radically changed. And also, I feel like I'm losing control of my body potentially in some really significant ways, like that are common but not normal, if that's fair to
Yep.
say.
Mhm.
How do you work on breaking some of those beliefs? Because I've had infinite conversations of people who've been leaking for 12 years. You're 12 years
Mhm.
postpartum and have been like, and leakage is still a thing. You can say, there's things we can do about this. Like
Yeah.
this isn't a permanent condition. Same thing with sexual intimacy issues, et cetera, et cetera. How do you go about breaking some of those beliefs that this is normal and okay?
Yeah, yeah, this is a great question too. I think that, we can never help somebody who doesn't want help. And that's like the most heartbreaking thing. So I think it's as coaches and as trainers and as healthcare providers, like it is so heartbreaking for us when we know we can help somebody, but that they're not willing to show up and receive the support. I think it's important to understand like it takes two to tango, right? So we can't help you if you're not willing to be helped. But what we can do is continue to create awareness. We can continue to have the conversation. We can continue to screen for it and educate. I think for the last like 15, 20 years, like our parents' generation, like our mothers and their mothers, this was very common and there was no education to instruct otherwise. There was no woman empowerment or motherhood empowerment to know that they could heal their pelvic floors. It was just considered quote unquote normal. And so generationally, this narrative has been passed down from our grandmothers to our mothers and then to us, where, like, I would say I'm the first generation where we're really actually starting to say, you don't have to deal with this. And all of the clients that we work with one on one, their moms also did not receive this support. So it really is like our generation, my generation, if you will. It's like this is the first generation that really actually is taking it into our own hands and understanding, like, hey, I can solve this. And so when stories are shared, the shame around these pelvic floor conditions really reduces. So that's one of the things that we're trying to do with our
Yeah.
podcast, of course, but also our page is how do we share more stories of the redemption, of the healing, so that other women can, even if they've dealt with it for 6 years, can see, oh my gosh, that mom Peter Pans for 4 years and she got better in 4 months, like maybe that can happen for me too. And so it creates this little crack of hope for women and mothers to see each other and see each other like thriving and having this redemption healing process that they then say, well, maybe that can happen for me too. And I think that's where it starts, is just more conversations, more of us raising the standard for what's acceptable and not acceptable.
And I think having those conversations really frankly, which I feel like we're doing, and I appreciate that. There's there has been and is sort of this lingering shame and embarrassment about discussing pelvic floor issues, and like you're not supposed to talk about it. And I've certainly felt this as a male trainer. Like I'm not supposed to ask these questions. I have to be incredibly careful of how I frame them. And there's an element of truth to that, where I would certainly never be I would hope I would never be vulgar or rude or something like that. But being frank and just kind of putting it on Front Street as the most normal, like, okay, what do you sleep? What do you eat? What kind of like urgency you're feeling around urination? What, like, having these be normal questions, make the more we do it as a community, I think makes it easier.
Mm.
Are there things you and your company does specifically to try and make clients, patients feel more comfortable having these conversations?
Yeah, I think what you said is perfect. That's what we do too. We really normalize the conversation, right? I talked about this in the presentation. It's only awkward if you make it awkward, right? And so if we're not making it awkward, and this is, very normal for us to talk about, and they're starting to hear the normalization of these questions, they actually pause and they're like, thank you so much for asking me that. Right. Like, especially someone in your position, like a male coach, where that working with other women, To be honest with you, I don't think that women would be offended by you asking that question. I think that we would feel really seen and supported and like, wow, thank you for taking the time to recognize me in a way that's not the same for you. Or thank you for taking the time to ask me that question. And so I think that the more courage and the more conversations we can have, and like, yep, this is just part of my intake. This is
Yep.
what I asked. This is just like my expertise, my knowledge, my skill set leads me to ask these really important questions and we continue to normalize it, then we're going to get more people volunteering the information, right? So that's what we feel is like on our onboarding calls, we have an hour-long onboarding call to really set the tone and help clients feel safe and supported and seen. And it's this face-to-face call with our clients that is very rare in the online space. And for us, that call is like pivotal because it really sets the tone for the safety that we're creating for the container for us to then journey together. When we can set the tone of safety and security, they're more likely to tell us things without us even asking. And all of a sudden, they tell us something about their partner or their spouse or their financial situation or their sleep or whatever it might be that we're like, because you told me that, now I understand why that's also contributing to furthering perpetuating your pelvic floor symptoms, right? And so when we normalize the process, when we lead with love and compassion and support, of course, because we want to learn from them, they will start feeling safe and then they will start sharing more information voluntarily on their own.
I was just gonna say, like, making it safe and making it easy to communicate is everything. I When I mentor other coaches that especially remote, the only thing that matters in remote work is communication. I
Yep.
don't care what your app looks like. I'm almost indifferent to what your program looks like. If you are communicating incredibly, it's gonna go really well. And if you're a bad communicator, it's going to go very poorly. And that's the end of the story. And it's on you/us to create the conditions where communication is easy and safe. They can tell you anything because it would never go anywhere else. It would never have any consequences for them. And it literally helps their program get better and better. The better the communication is, the better the program gets because you can really hone in on their individual needs.
Yeah, that's brilliant. I never heard someone say it in that way, but you're totally right. Like I think in the virtual support world and especially in a health and fitness space, like communication is everything. You can, shadow it by doing any fancy routines and exercises in the gym. It's literally communication. And so if we're not able to provide that safe container for them, then we haven't done our job well.
Yeah. Are there, I'm sure there's lots of them. If there was like one or two big misconceptions about pelvic floor health out there, are there any that particularly get under your skin or you want to set the record straight?
Oh my gosh, yes, please. The biggest one I think is so many people think of pelvic floor and then they just think of postpartum only, which I completely understand, right? They're pregnant. They're like, oh, I'm leaking now. I can't be helped, even though I'm pregnant. I'll just get help after I have the baby. Or like, what's the benefit of me getting support now during pregnancy when I'm just going to have this baby and it's going to get worse and then I'm going to get support in postpartum. I think most people tend to think of pelvic floor recovery postpartum, or at least that's some of the traction that I'm seeing online. So, number one is pelvic floor conditions are not related to pregnant or postpartum, right? Like I said, men can have pelvic floor issues, kids can have pelvic floor issues. And also, women that have never created a child or have bared a child can also have pelvic floor issues. So that's a big one. And then two, if you are having pelvic floor dysfunction, the best time to get support is when you notice the pelvic floor dysfunction. It doesn't matter if, oh, I'm wanting to conceive, so I'll just wait, or I'm pregnant, I'll just wait until I have to have the baby. Because when you are noticing the issues arise, if you can get on it quicker, then it will rehab much better, right? Like if we know that this has been going on for 1 month versus like 1 year, you're still going to make support if you're still going to make progress if it's been going on for a year. But the best time is like acute and early so that we can make the most amount of progress so it doesn't turn into other issues down the road by masking, further concerns. And then it's just stacking. Now it's pelvic floor. Now it's the hip. Now it's the back. And it's like, before you blinked, years went by. Now you're dealing with four things instead of just one. So let's solve it when you notice the first thing coming up.
For people who want to work on that, how do you suggest they start addressing it? Should they start with exercises? Are we starting with kind of pelvic floor core connection work? Are we going straight to a professional and asking some questions? Like someone just heard you say that, say, "Oh, I should probably do something right now. I
Oh my
should do
God. Okay.
something."
So if you heard that and you're like, yes, so I actually think I do have some symptoms, I highly recommend just working with a professional one on one, right? Do it in whatever space that you feel confident, whether that's in person or whether you want an online experience. There are so many people out there to make it happen. We specialize in one on one online because it's what we feel like we can give the most comprehensive, continuous support to get clients results fast. And they don't have to drive to and from appointments or travel, more places and get childcare involved and make all that happen. I think what's really important here is that people don't just sit on the information and then not do anything, right? Because you can get started with random YouTube videos and breath work and mind body connection and Kegels. But like I said before, Justin, it's like we don't know the state of their pelvic floor. So if we just start doing Kegels because we're trying to be, proactive, well, what if you're living in a really hypertonic state and then you end up doing Kegels because you quote unquote think you're helping yourself? And it actually makes it even worse. So I think what is really important is for someone to get an assessment, for someone to talk one on one with a specialist in this to just share all of their concerns. Like I said before, like leakage isn't a cause of one, there's no one perfect blueprint or one perfect exercise, in my opinion, that's going to solve it. It really is going to be needed to be customized to each individual person.
There's someone out there also, I'm just imagining people listening to this, who heard you say that and is jumping up and down about how they have to be in person, that you cannot possibly make progress without manual work. You cannot possibly make progress without an internal exam. You cannot, and I, as someone who's referred people out for this reason, I was like, there's some stuff going on and I can't tell and I'm not allowed to look. So I'm sending you to someone who's qualified to do this. Not that I would, obviously, but like
Sure,
that
of
is
course.
well outside of my professional scope.
Yeah.
I'm going to send you to someone who does this for a living. Two questions. How do you get so much done not having that in-person option? And then kind of follow up, do you guys ever, as a company, do you refer people out for manual work ever?
I would say like less than 5% of the time we're referring people out. Like I would say 95 plus percent of the time we can solve all major issues 100% remotely. We really do not need to be referring people out. The people who might benefit, and if you're listening to this, like maybe you can say, oh, that's me, I really need that, is if they rely so heavily on someone's physical contact in order for them to feel like healing is important for them. And there are people out there that like the virtual setting is tough for them and they really want to be in person, having more of a hands-on approach. I will say the research does not support a hands on support approach, right? Manual therapy has pretty much been debunked in all rehab and physical therapy and occupational therapy, where it's more short term
Yep.
resolution versus long term sustainable support, if you will. So, a lot of the literature in the rehab world shows hey, we need to be doing less manual therapy and more education, more awareness, more guidance towards strength training and keeping their body strong and functioning over a longer period of time. Like it's not just this short, quick fix. Somehow the pelvic health, field is still very much really holding on to, but we have to use our hands and we have to do these internal exams and I can touch it so I should. And I think that I get it, right? Like I was in person for 3 years before moving to online work, 100% online now. And so when we first moved online, it was during the pandemic. And so that's when we shifted and we made that shift. And I was skeptical at first too. I was like, am I really going to be able to get clients online, like results online? And what we found to be true is very consistent with the literature that's now consistently starting to come out about, telehealth versus in-person pelvic floor therapy, that there's no difference at 12-week follow-up and 1-year follow-up, whether you got virtual support or whether you had in-person support. So again, it's like very consistent with what we already previously knew about the manual therapy aspect in the rehab world, that a lot of clinicians and physical therapists were trying to move away from manual therapy, more passive modalities, and more towards like behavior mindset change, nervous system, stress management, and strength training. And that's where the field is starting to
Yeah.
move. So, same thing for pelvic health. We just have to be willing to shift the paradigm and be willing to be a good communicator. Because, like you said, the virtual really does rely on communication, resources, education. But what I find beautiful about the virtual side is that we're actually empowering this person to know their body and allow them to believe and get in tune with their body on their own versus outsourcing their power, outsourcing their healing to some other physical person that's going to quote unquote heal them with their hands. They start realizing, whoa, if I start getting to know my body, if I start getting connected to my body, I actually am taking my power back in a way. I'm able to then understand how to do manual therapy myself, so I don't need to drive to the clinic and get somebody else's fingers all up in my business if I know how to do it myself at home. So it's not to say that we don't use manual therapy approaches. We do for the right individual, for the right specific person, but we teach them how to do it themselves or how to include their partner if they're comfortable. And I think that's really empowering because we're now giving them tools for life versus making them reliant on some else from some other provider that's going to quote unquote fix them that they have to keep coming back to over and over again.
And you're speaking to something that we at Feel Strong as a company has been screaming about basically since we started. And in my experience, the best professionals do, whether
Mhm.
they're MDs or PTs or whomever, and that is creating autonomous people. Like, I want you independent. I want you in control. I'm not trying to fire you. I don't want to run you through 12 weeks and get you gone. I want to educate you and teach you how to do all of this so you never need to hire someone like me again. If you want to come back and work together and we're inspired to work together, cool, we can do that. And there's lots of reasons people do that, but you don't need to. I really,
Yes.
really want you to not need me. And I think that's a really inspiring way forward and kind of breaks that. Going back to the manual therapy, there's lots of short-term relief benefits to all kinds of manual therapy. And sometimes I've found that is the thing that you need to open the door, right? If someone is in so much pain or they're so tense or something's going on and they can get some myofascial release or some internal work or something, and that opens the door where we can get a bunch of work done. That lets me work hand in hand with the physical therapist really well. They created that space. I can get a bunch of strength and mobility work done. And now we're really moving forward. But sometimes, and certainly it's the business model that's often taught in schools and is sort of the norm still, but it's also a way of putting a fence up as a professional as well. I have these special secret tools and special secret things we do that no one else can do in their mind. Like, well, yes, but that's not close to the most important thing that you do. If we all share resources and agree that actually I'm the strength and endurance expert, you're not, but you're the pelvic floor expert and I'm not, and you're the nutrition expert and I'm not, and you're now we can get everyone on the same side of the table and helping this one person that we care about. Now they have a healthcare team who is trying to create an independent person and not a bunch of people scrabbling for clients and putting up fences around their sort of magical so-called land of expertise. Sorry, I get excited about these
Oh
things.
my gosh, I love this so much. This is such a great conversation because creating empowered people is so important, right? When we disempower them and we take tools that are very much available to them away from them, it then creates them to be reliant on other people or other processes or other systems or other things versus them being able to take ownership. So, one of our core, belief systems and values at our company is radical responsibility, and that's not just as us as coaches, it's our radical responsibility to also make sure our clients feel that they can be radically responsible for their lives. And I think too much when we get too attached to a specific diagnosis, even, or too attached to a specific modality over a long period of time, it really creates this disempowerment within their own selves. Where then they become, oh, I need this person. I need this modality. I need all of that. So, kind of what you said, is this short term solution to open the door? 100%. I feel very similarly. Let's use the manual therapy, the passive modality approaches to calm the nervous system potentially so that we can do more of that. That can still happen virtually. We can still do the modalities and we can still do all of those things and teach them how to do that or bring partner support in so that they still feel empowered, but they still get that relief that they might need through the modalities or through the manual therapy or through the mobility work that will create some of that space, like you talked about too.
And I think explaining it in the way that you just did, which is very well put, can also be so useful for clients. When people have their special warm up or the foam rolling routine or the thing with the lacrosse ball or the breath work warm up, and they have to do this. No, if I don't foam roll for 20 minutes a day, like things really fall apart. When you can reframe that, say, well, this is what you're doing. You're actually creating room for your nervous system. You're showing that it's really safe to move in these ways. We can actually progress this and make it better and better and better. And there's nothing wrong with a foam roller, but 20 minutes on that, if you've been doing it for 4 months, we're probably not using your time the best way we could. If we reframe it as, well, here's what you're actually doing. The foam roller's not magic. You probably knew the foam roller wasn't magic. You're rewiring your nervous system. Here's 3 other ways we can do it. And you can work on it during your day. And now we have someone who's learning and getting better and leaving behind some of the things that were useful, but they aren't tied to it. They don't need it. And they don't have a panic attack when they forget to bring their foam roller on vacation or something.
Yeah, yeah. We, talk about this in neuroscience of like shallow or deep tractor wells. And it really is about creating flexibility in the nervous system, creating flexibility in the belief patterns and flexibility in how we navigate our day-to-day lives. So like the more tools that we can give people to understand different ways to do things, it provides healing to happen so much quicker. Half of, I'll tell our clients, like honestly, on inquiry calls with people who are inquiring to work with us or our current clients, we tell them the number one predictor to you finding success in this program and healing is that you believe that you will find success and you will heal. So we can either stick to the narrative that you've been leaking for the last 6 years and no one's been able to help you and you're not going to get better and you can believe that, or we can shift the narrative and we can give you other tools so that you can reframe these belief patterns and reframe the nervous system spiral that you were talking about too. Is how can we open the door to allowing people to know that you have at any moment the power and choice to decide what narrative you want to believe or what modality or what pattern or what routine, and that those are flexible and they can be flexible and we have the power to choose that change.
I do the same thing on intake and I will walk you down the path of belief as long as it takes. But if we get to the end and you say, well, no, there's no, I'm never going to be able to run again because my back is always hurt and I just have a bad back. That's never going to happen. We might not work together. Like
Uh-huh.
if you can't open the idea of a possibility of that happening, it's just not going to work. So building you the perfect program isn't going to help anyone. Maybe 4 months from now you'll be ready, and that'll be cool. Like, well, I guess it could happen. That's all I need. But if that opening doesn't exist, nothing I throw at it is going to work.
Mhm. Mhm.
We're talking about all these tools and resources. As someone who works with lots of different people, what have you seen are kind of the biggest barriers to people getting help, getting started, being able to get screened to some degree, things like that?
Yeah, I think the biggest barrier is really consistent to the theme that we've talked about is them believing that they're going to get better. And the barrier could be them actually asking for help, right? Like we can't help people who don't want to be helped. And so the biggest barrier and limitation is like a lack of self trust or belief in themselves, either to reach out and get the support that they need or to believe that healing is possible for them. And so I think for me, what I feel like the biggest barrier, the biggest thing that we can work on is awareness and education consistently, allow them to see it from multiple different angles, from multiple different people saying different things different ways, allowing them to resonate with whatever feels in alignment to them and move forward with that, and just continuing to provide opportunities for them to say yes to themselves. And this goes for anything: health, nutrition, strength, public health, right? There really is in this day and age so many access to resources and information. We're actually like not in an information shortage era, especially with the
Quite the
scale of
opposite.
AI, right? Like information, we don't need to sell information anymore. Information is everywhere.
Yep.
But what's really missing for people is the relationship, the coaching relationship, the mentor, the guidance, the person who's going to say it's okay to go at 80% throughout the rest of the year versus at 100 and then 40 and then 100 and then 30. And like it's the coaching relationship, it's that mentorship, it's the ability for someone to work alongside you to give you that more customized specific guidance, because information is useless unless it's customized to that individual and that person. So I think that sometimes the barrier also is information overload, where people are receiving so much information from so many different directions that they then freeze and they don't really know what to do next. So I think as, coaches and as people who support others, it's like, how can we make the process so simple and easy for them? How do we make it so clear of like what that next step is for them to take so that people can start saying yes more?
Completely agree. I have found, especially with moms, there is way, way, way too much information. And there's a huge, like everything in the fitness wellness community, unfortunately, there's a huge segment of people who are just trying to terrify a potentially vulnerable population to make money off of them.
I
And they
know.
are not trying to help. And I cannot stand those people. In that note, I thought we might do a little kind of rapid fire fitness question of the stuff I always get asked and I tell people, but having you say it sometimes might have more weight.
Okay, let's do it.
How soon can a mom start exercising postpartum?
Day 1. I mean, you can, right? Like, the intensity matters. So, obviously, we're not working out the day after you have a baby, but there are very simple things that you can do in your bed, around your bed, that is mobility based, that's breath work based, that's reconnection based. If you had a C-section, we want to get you up walking a little bit quicker than if you had a vaginal birth. We want you more horizontal for those first 2 weeks. So, really, there is no too early or too late. So you can literally start doing things after you have your baby, which is what I've done and we do with our clients. If we work with them in pregnancy, we just roll right into 0 to 6 weeks of early acute rehab, is what we call it, where we know your body's in a vulnerable healing time, but there's still 5-10 minutes a day where we can commit to getting mobility and reconnection started for you.
You rolled exactly into my next one. Lots of people go in for their 6 week postpartum checkup. They get told, high five, you killed it. You're clear to exercise. Go do whatever you want. What does that mean?
Nothing.
Yeah.
I mean, it's unfortunate, right? And I think that, what other injury are we saying, okay, you just had a major musculoskeletal event. Don't do anything for 6 weeks. And then at 6 weeks, I'm going to wave the magic wand and you can do anything that you want. You can start exercising, you can have sex. Like, it's just so comical actually if you really break it down and think about like a musculoskeletal injury in that way. We would never instruct, especially in the rehab world, for anyone to go through a massive musculoskeletal change and traumatic event like pregnancy, the birth, and postpartum, and then tell them to do nothing. And then they tell them they can do everything. So to me, that really means nothing. I think that we really need more women and mothers feeling empowered in their own intuition and in their own selves to start asking questions to qualified professionals sooner in the process. And that's why I say, like, getting support in pregnancy actually allows you to have that team so in pregnancy, so that you're not scrambling postpartum when, all of the craziness and you're learning how to feed and you're like having
You're
struggles
not
with that and
sleeping.
you have multiple kids maybe. And it's just like, oh my God, that is such a stressful time to like find a provider that you relate with and that you connect with and that feels in alignment to you. It's like start in pregnancy, get that established team going then, and then just stay with them into postpartum and it'll be so much smoother of a recovery and process.
Are there movements that postpartum people, again, we're generalizing obviously, but that should, are there movements they should definitely avoid, but slash definitely modify? Are there things postpartum people should not be doing?
Yeah, I think it depends. I know that's such a gray answer, but I think like, how far along are they postpartum? What kind of birth method did they have? Did they have any particular birth injuries? Like, did they have a first degree tear or a fourth degree tear? Did they have forceps delivery or not? I think there's like so many layers, which is why it's so important to work with someone really qualified in this aspect. But I think a gradual approach is most important, right? Like, if we're just going to really break it down to basics, those first 6 weeks, you really should be like on your back, on your side, or on your hands and knees, which really eliminates a lot of gravity induced positions. So, especially if you've had a vaginal birth and especially if you've had a second, third, or fourth degree injury, upright movements and really loading the body and loading the pelvic floor is probably not going to be in your best interest. And really trying to rebuild the foundation in a non gravity induced position first is going to be more conducive to a smoother healing process. And then, as your body gets further out and as the muscles and the tissues are reconnecting and regaining mobility and nervous system activation and strength, then it's like, okay, let's put you in a more upright position where we're challenging you with, body weight or light band resistance, and then working up from there. Where we see people really get injured or really backslide is they're like, I'm going to get my pre baby body back at 4 weeks postpartum or even like 6 or 8 weeks postpartum. And then they just like, go to the gym and they're like, well, I'm just going to do body weight. And it's like, well, that's still, you missed like the entire 2 phases of our program, which is mind body connection and tissue loading. Like, you missed the whole part of like really focusing on pelvic floor and core rebuilding. And then let's move you back into the gym and body weight. And then let's start adding dumbbells and barbells and all of those things. So to answer your question succinctly, I guess it's like a gradual approach is going to be the best, and trying to limit heavy, like, load in a gravity position early on.
Yeah, that makes perfect sense, and is how we reverse engineer almost anything.
Yeah.
I just wanna go for a 3-mile run. Great, super cool timeout.
Yeah.
Let's make sure you can achieve this position, and this position, and this position, and this position. And did your ankle even move like this? And how are your hips? And how is your posture control? And how is your mobility? And can we rotate from the pelvis? And we could, oh, okay, we're putting together what a person who could go on a 3-mile run would look like. And then we can find the things we need to work on and set some benchmarks and go there. But going from 0 to 60 doesn't make sense. You just went through something very significant. You are not where you were 10 months ago. And you know that. And having it take X amount of time is okay. Whatever that ever I have certainly found every pregnancy is different. Even like pregnancy 1 to pregnancy 2 with a mom, radically different timelines, radically different results, radically different issues, radically different strengths. It's going to be different. We're going to have to figure out what's going on.
It's so true. Yeah, every pregnancy and every postpartum, every
Mhm.
labor, right? They're all different, and so we really need that more tailored approach to depending on that particular mom for that particular pregnancy, birth, or postpartum.
Pregnant and postpartum people are regularly told don't lift anything heavier than X. That number seems to move. I've heard 5, I've heard 7, I've heard 9, usually nothing over 10. How important is that?
I think that's so silly, because it's just like not relative to day to day life and functions. Like, I have 2 kids, right? If I have a toddler and he weighs 35 pounds, like you're telling me not to pick him up, I'm a little confused. He's got to get in the car seat. We got to get going to pick up his baby sister from grandma's. Like, you know what I mean? It's just like it's not even real life, right? We're not living in a village anymore. We're not living where everyone's just mothering the mom, while she lays on her back. Not that that's healthy for her either, but it's consistent that making sure that we are building strength in pregnancy is actually really helpful for the labor process, the birth process. It's really helpful to make sure that we're not muscle wasting for 9, 10 months and then all of a sudden starting to work out again in postpartum without considering you just took the last year off and you're going to start hitting the gym. So it's important to maintain as much strength as possible. It helps reduce pelvic floor dysfunction. It helps reduce hip and back pain and all of those things. It creates for a smoother labor experience. It creates more of an easier and smoother postpartum recovery experience. So I think it's actually like we need to teach moms how to lift and how to do it safely and effectively and how to build up their strength in pregnancy. Of course, everyone's going to be so different. So if you're not lifting at all and you're listening to this and you're 6 months pregnant, that doesn't mean just like go start lifting. Like that still means like work with someone to like help navigate that transition for you, but building strength in pregnancy actually is really healthy and really safe.
It only makes you more resilient. We know something big is coming. We know you are going to have a comeback. Let's train for that. There's not a ton of times in life when you know for sure an injury is on its way. We
Yeah.
have we have 9 months to train for it. That's the most. I'm down for all the other goals. 2 through 10, we can work on all the other things, but number 1 is we're training for this thing. We know it's coming. We want to be, game day is on the way. We know what the day is. The Super Bowl has been set. Let's go. That's what we're training for.
Isn't that crazy that that's not like standard education? It's like if you were going to go run a marathon, you're like, yep, just show up. It's on Tuesday at, you're just going
Yeah.
to start running. It like doesn't even make sense. You
You'll
would
be good.
actually
You were
like
built
have a
for
training
this.
plan.
Well, hold
Yeah.
on. Like, sure, I can move my legs, but I can be better prepared for this than
Mhm.
some other people. Dr. London, this has been an absolute joy. I feel like I could do this for another hour. Tell people where they should go and how to find you and about your postpartum PT.
Yeah, absolutely. So we're on Instagram. That's our main platform that we're on right now. It's at your postpartum PT. Feel free to DM us, and you can chat with us to see if we can support you in any way. I think I gave Justin a link if you want to book a call to inquire more about working with us one on one. You can always click that link. I'm sure he'll put it in the show notes for you. And then, two, we also launched a podcast as well called What About Mom? And we talk about all things. It's pelvic health, women's health, but it's also about all of the TMI taboo topics that is not talked enough about in motherhood. So you can come follow us along over there too.
I absolutely love it. And congratulations on the podcast.
Thank you so much.
Of course. Thank you so much for coming on the Feel Strong.
Yeah, absolutely. I'm so impressed with this conversation and furthering the conversation.
Thank you so much. That means the world. I really appreciate it.